and the drugs like adenosine beta blocker, calcium blocker, and digoxin. Hypoglycemia and hypothyroidism also cause sinus bradycardia. What's the treatment of sinus bradycardia? Isoproterenol, atropine, and theophylline. And what is relative bradycardia? The pulse temperature ratio is 10:1. What does it mean? It means that if there is a rise in temperature by 1 degree, the heart rate increases by 10. But in certain conditions, the heart rate does not increase with the increase in temperature. It increases, but it doesn't increase that much. So that is called relative bradycardia. And what is the most common cause of the relative bradycardia? The most common cause of relative bradycardia is use of beta blocker drugs. The causes of relative bradycardia: CNS disorders, lymphoma, drug fever, infections. So which infection causes relative bradycardia? The gram-negative intracellular pathogens, they cause relative bradycardia, and they are typhoid, typhus, Rocky Mountain spotted fever, and Legionnaires disease and chlamydia. The mycoplasma do not cause relative bradycardia. What happens in the typhoid fever, that there are splenomegaly and hepatomegaly. What are rose spots? It's a maculopapular rash in typhoid, and the most common site for that is on the trunk or the chest, and it disappears in 2 to 3 days. The next topic is sinus tachycardia. In sinus tachycardia, like sinus bradycardia, unlike the sinus bradycardia, the rate is more than 100 beats a minute, and like sinus bradycardia, only ECG abnormality is a contracted QRS. So in sinus bradycardia and tachycardia, in both of them, the QRS is contracted. See, the rate here is it's 2, so it's 150, about somewhere around 150. So in both sinus tachycardia and sinus bradycardia, there is a decrease in cardiac output. The ventricular filling time is decreased, the coronary flow is decreased, and there is an increase in myocardial oxygen demand. All these factors, decreased cardiac output, decreased ventricular filling, decreased coronary flow, increased oxygen demand, they may precipitate an ischemic heart disease. So what are the causes